Resting heart rate is the beats per minute your heart is when it's at rest in most calm state. The average resting heart rate is 60 to 100. Times when your heart rate is at rest would be when you're calm, during the night or early in the morning when you wake up.
A high resting heart rate can be caused by a number of things that can generally cause stress in your life, like anxiety or not getting enough sleep, not eating right, having too much salt in your diet.
This means that your heart has to work harder. It can also signal things like stress and dehydration, sometimes sickness, all of those things, including emotional symptoms like anxiety. Low resting heart rate sometimes can be completely normal in a young or athletic individual and sometimes can signal increased cardiovascular fitness.
If you start to have lower resting heart rates and you aren't actively doing exercise and you have a resting heart rate that is down at below 50, that could be a sign of a problem that your heart conduction is not good. Both need to be monitored.
The best way to check your resting heart rate would be the radial pulse, which is on your wrist. That seems to be where people can find it the easiest, but you also can check on your neck or by listening to your heart with a stethoscope.
It's important not to get caught up in one individual reading as far as a resting heart rate. Certainly there can be variation from day to day and time to time, so we can't just use one isolated resting heart rate to tell the whole story.
So there's a few things that people can do to lower their resting heart rate. Mostly it comes down to self-care. So exercise, primarily aerobic exercise, is really good in lowering resting heart rate, as well as doing things like limiting your caffeine intake, limiting your nicotine intake, and sleeping enough.